Welcome back to In Time TV's On the Edge Conversations in Internal Medicine. I'm Dr. Jonas Moses. With me this hour, Dr. Doron Feinsilber. This hour we have been talking about reflex sympathetic dystrophy and complex regional pain syndrome, and the time has flown by. I do want to pick up our conversation. During the commercial break, we talked about some other processes that are associated with this. Just quickly, you mentioned vasculitic syndrome, PAN, and Kawasaki's syndrome disease.
Yeah, one of the first things that you look at when you have a patient who comes in with a pain syndrome, again, like I mentioned, like fibromyalgia, mixed connective tissue disorder, gout, other things like that. But one thing that can happen too is that you have something called a vasculitis, which is basically an inflammation of the vasculature, be it in the small vessels, medium-sized vessels, or large vessels. And so a child that comes to you may have something called Kawasaki's disease, and that type of, now that's all, they can also present with, pain associated, basically in the upper extremities and things like that. It needs to be treated early, because if you don't give them aspirin pretty quickly and lower that inflammation, that can cause cardiovascular issues in the future. With adults, you can have conditions like temporal arteritis and polyarteritis nodosa, which has an etiology with hepatitis B exposure, and that can also cause the same types of syndromes in the upper extremity, pain issues under the skin and whatnot. Once you can rule those things out, that's how you can focus and catch the RSD early enough to treat it before it becomes more peripheral, more chronic.
Okay. So you had said that you wanted to follow up on the on opioids.
Yeah, that's extremely important, and especially when we're taking this from an internal medicine standpoint and from an inpatient standpoint, the opioid abuse is dangerous. Someone who, that's why I'm very careful about when I write a prescription for anything, even like Percocet, which is also an opioid mixed with acetaminophen. I always write in the prescription, 12 tablets. I write the number 12 and actually spell out the number 12, because people will forge the prescription pad because they get addicted to these things. If you're on those for too long, you can have a small bowel obstruction, because again, it slows down the GI tract because of the mu receptors, things like that. What's dangerous is that if you have someone who doesn't have RSD, for example, or let's say that you're giving him morphine judiciously, then the withdrawal can be extremely dangerous. And I know that I've had people jump into the ICU just for 24 hours because they were suddenly taken off their medication for whatever reason. Sometimes they get admitted, and then the charge nurse doesn't write the order properly, or if they're normally on morphine, they forget to give it to them, or they put it at a lower dose. And that can be extremely dangerous, and that actually requires intervention by giving the patient something called clonidine, which is an alpha-2 antagonist. That will actually decrease the sympathetic response to withdrawal. And so that's associated with this also, because if you have a firing of the sympathetic nervous system, that can be fatal, potentially. So that's why I think that things you mentioned before, like Lyrica, or using gabapentin, which is also prevents neuropathies, or things like baclofen, those are probably better types of treatments, along with the ganglionic blocker that's done with an anesthesiologist, because when you give those types of medications that are opiates or fentanyl, things like that, you always carry significant risk, particularly with withdrawal. So I tend to be a little more careful with that. So
I want to take just a moment here to talk about there are a couple of organizations associated with RSD-CRPS. One of them is the International Research Foundation for RSD-CRPS, and that is www.rsdfoundation.org. That is the association with which Dr. Anthony F. Kirkpatrick is associated, and there's a lot of information that can be found there. There are a number of videos that can be watched there, and that is where you can find the clinical practices guidelines. There is also the RSD Syndrome Association, RSDSA, and that is www.rsds.org. And that is where I got the information regarding the two types of RSD, the complex regional pain syndrome 1, type 1, and type 2. If you Google RSD, CRPS, you certainly can find an abundance of information. The International Research Foundation for RSD, CRPS, I believe, is a kind of a flagship organization. And I do want to thank you so much for joining us this hour. As always, enjoyed. There's a great deal yet to discuss about the disorder and the syndrome associated with it. Plainly, This is a process that you want to catch as early as possible, as young as possible.
Right.
I cannot emphasize enough that if you catch this process early in young children, there's a chance of reversibility on a short course. As time progresses, this becomes a chronic condition, and there's a mortality rate associated with this, not just as a disease process, but for the depression overlay. You have been watching this hour in Time TV's On the Edge, Conversations in Internal Medicine. With me this hour has been Dr. Doron Feinsilber.
Thank you.
Thank you so much. Dr. Feinsilber is our internal medicine special correspondent. You can always join In Time TV's conversations by sending an email to ask@intimetv.com. If it's not a live program, we will receive your comment or question, and we will bring it up at the beginning of the next show. You can also join our shows at www.intimetv.com. I want to remind my viewers that I do have a new blog site, and that is www.jonasmoses.blogspot.com. And I welcome your visit to that blog site and hope that you will feel free to comment on the commentary I've written there. As always, if you have an interest in being a guest on our show, please write us at the studios and let us know. I welcome guests from all different kinds of disciplines, clinicians, medical researchers, people in public health, public policy, people in government, in industry, innovators. Whatever your specialization is, I would be very eager to hear from you and to know what it is that you wish to discuss. I'm happy to entertain any and all takers. You have been watching this hour again in Time TV. Dr. Doron Feinsilber has been a wonderful guest to have. We have been talking this hour about reflex sympathetic dystrophy and complex regional pain syndrome. For In Time TV, I'm Dr. Jonas Moses, on the Edge.